歡迎大家出席今日。
Welcome to the press briefing. With us today are Dr. Albert Au, Principal Medical and Health Officer, Center for Health Protection, and Dr. Lau Ka-hin, Chief Manager, Hospital Authority. Dr. Au and Dr. Lau will brief us on the cases and the situation at DHA respectively. Dr. Au, please. Good afternoon. I would now report the latest situation on COVID-19 from June the 30th. Yesterday, there were 2,165 locally acquired cases, including 761 cases confirmed through PCR tests, 1,404 cases verified RAT results. Yesterday, there were 153 imported cases, of which 128 tested positive through PCR tests and 25 tested positive through RAT. As of now, since the fifth wave started, Hong Kong recorded a total of 1.235,484 positive cases. Yesterday, there was one new fatality. As of now, since the fifth wave started, Hong Kong recorded 9,189 deaths. I would now invite Dr. Lau to brief us on the situation of DHA. Currently, 666 COVID-19 patients are staying in hospital, of which 73 were new cases. For those in isolation facilities, 210 are staying in our isolation wards, 14 are staying in Tier 2 beds, 229 are staying in the North Lantau Hospital Hong Kong Infection Control Center. 58 were newly confirmed cases. Yesterday, there were no newly reported patients in critical or serious condition. Of the hospitalized patients, 11 are in critical condition and 11 are in serious condition, of which 3 patients in critical condition are in intensive care. Over the past 24 hours, an 88-year-old female patient diagnosed with COVID-19 passed away. She was a resident in a residential care home for the elderly, and she had to be intubated, and she had a number of chronic illnesses, including dementia, and she suffered multiple strokes. On the 23rd of June, she had shortness of breath, and on the 25th, the PCR test result was positive. CT value was 23. An antiviral drug was prescribed. She also had URTI, and the patient passed away yesterday. Over to Dr. Au, please. Of the imported cases, there were 153 cases detected at the airport specimen collection center. 47 tested positive at quarantine hotels. For the remaining 21 cases, they tested positive after quarantine was completed. In terms of residential care homes, 4 RCHEs reported new cases involving 2 staff members and 3 residents. The first is the Lai Yun Hui Arnold Yun in Kwai Ching. 1 carer tested positive. He received 3 doses. He last reported to work on the 27th, and he started showing symptoms on the 29th. The PCR test on the same day was positive. 17 other residents in the same home were classified as close contacts. Another was a residential care home in Eastern District. A resident had 3 doses, and she tested positive on the 30th, and on the 26th, she went out. 3 residents from the home were classified as close contacts. The third home was the Gang'an Wulou Jiga in Southern District. 1 carer tested positive. He had 3 doses, and he started showing symptoms on the 26th, and the PCR test on the same day was positive. 3 residents were classified as close contacts. Another was the Yun Yun elderly care home in Shunwan, and on the same floor, that was the 3rd floor, 2 other residents tested positive. They both received 3 doses, and they had close physical contact. they started showing symptoms on the 30th, and the RAT result was positive on the same day. 9 other residents on the same floor were classified as close contacts. Since today's public holiday, there were no newly reported cases from schools. In terms of the genome sequencing for BA.2.12.1, yesterday the public health laboratories found 31 suspected cases with the BA.2.12.1 strain, including cases that were epidemiologically linked. 19 cases were untraceable so far, and 6 cases were epidemiologically linked with these 19 cases. These were their family members. For these 19 cases, they involve multiple districts of Hong Kong, and so far no links are established with other cases. 6 cases were epidemiologically linked with prior cases. They stayed in the same buildings but in different units. Some were found through the compulsory testing notices of buildings, including Shanking Estate King Wah House. There were 2 cases, and there were prior cases at another unit of the building. Another case was Shanking Estate King On House. A family, two people from the same family tested positive, and earlier through CTNs, cases were found at 5 other units. Another was Lok Fu Estate Lok Shui House. There was 1 case. Finally, at Shek Kip Mei Estate Mei Leung House, there was 1 case. For BA.4 and BA.5 cases, yesterday there were 36 suspected cases so far, of which 19 were imported cases. 6 were locally acquired cases with unknown origin or established ties with other cases. 3 other cases were related to these 6 cases. They were their family members. These 6 patients stayed at Nam Shang Estate, Block 5, Cheng Yat House, Kim Ming Estate, Ming Wick House, Metro MOS Town, Phase 2, Block 2, and for these 3 cases, each family had 2 cases. Another case was Siu Sai Wan Estate, Shui Lok House. Another case, Ching Lok Estate, Chen Hin Court. Finally, Tsinghua Court. We also found 8 cases that were epidemiologically linked with prior cases, including 7 new cases who visited Hot Pot Foodie in Kwun Tong on June the 24th. We issued a compulsory testing notice for the restaurant last night. So far, for this restaurant, in the evening of the 24th of June, 11 cases were involved, including 8 males and 3 females, and they started showing symptoms from the 26th to 30th, and they were aged 36 to 56. Through the vaccine pass, we obtained particulars of the patrons, and we would look at their test results later. Another case was related to a prior case staying in Hong Kiew building. Of the announced cases for BA.4 and .5 yesterday, there were some revisions. 1 case announced yesterday stayed in Discovery Bay, and he returned from Dubai, so he should be an imported case instead of a local case. For 2 other cases, they were doubly counted, including 1 staying in Tuen Mun Fu Tai House, and another stayed in Shunning Building. So after the revision, there were 26 suspected BA.4 or .5 cases. 16 were imported, 6 were untraceable, and 4 were epidemiologically linked with prior cases. So far, for locally acquired BA.4 or BA.5 cases, we found at least 63 cases, including 6 related to the cases found at the airport or quarantine hotels, and 6 were epidemiologically linked with those working in high-risk areas. They were mostly family members. Another seven cases were related to imported cases. One case was detected on 7th day. Another was detected on the 9th day. They were family members of prior cases. 20 cases were untraceable. Another 24 cases were related to those 20 cases, and they mainly involved family clusters. That is, there were multiple cases within the same family. Of these cases, one workplace involved 2 cases. That was the person working in the kitchen of a Pull & Cook daycare center for the elderly, and the restaurant I just mentioned. The rest were close contacts to prior cases. We did not see transmission going on at buildings so far. Most of these cases were less serious. None of them had to go into intensive care, and there were no fatalities.
For the past day, 94 patients have recovered. Among them, 79 have been discharged. Since the outbreak of the 5th wave, 52,025 patients have recovered. 51,689 patients have been discharged. Since the beginning of this year, the city has seen 64,405 patients who have recovered. 64,069 patients have been discharged. 2 patients have been found COVID positive through admission screening or testing in the hospital. 4 patients in the same ward have been classified as close contact. For HA staff members, 24,382 staff members were infected. 24,078 workers have returned to work. That's all from me. The floor is now open to questions. Please put up your hand. Our staff will pass you the microphone. Before putting your questions, please identify your media outlet. The lady in white. I'm from HK01. Now for Hot Pot Foodie in Kwun Tong, the case is there. Who's the patient with the earliest onset? Is there any chance that this was a super spreader? Has the restaurant suspended operation? Have the authorities taken environmental samples at this place? Yesterday, you mentioned for BA.4 and 0.5, there's immune escape at work. Some experts argue that BA.4 and 0.5 cases may become the dominant strain in Hong Kong. What's the CHP's take? For the local case count, if BA.4 and BA.5 subvariants are at work, will there be a faster surge in the daily case count? It's July 1st today. There are group gatherings across the territory. Will there be more cases across the city? The first question, Hot Pot Foodie. Now, as we were doing the epidemiological investigations for BA.4 and BA.5, we found this cluster involving 4 people. On the evening of June 24th, they visited the place. Last night, we issued a compulsory testing notice, and we obtained information through the vaccine pass system. We found out that more cases emerged from the patrons who visited the restaurant. We got in touch with the FEHD. They inspected the place regarding the place's hygiene conditions and the use of vaccine pass. We have obtained some information through vaccine pass. We're collating the information and cross-checking to see if further cases are uncovered. Some staff members may be visiting the place and taking environmental samples for testing to see if any samples turn positive. We've also got in touch with the EMSD. The investigation is still ongoing. We have asked all staff members of this restaurant to get a PCR test. The whole eatery will have to undergo thorough cleansing, and they have done that. The second question for BA.4 and BA.5 subvariants. Recently, there are more cases involving the BA.4 or BA.5 and their local cases. Almost half of such cases are untraceable cases. And we don't see any link between these cases and imported cases or those working in high-risk locations. In different parts of the city, there may be silent transmission chains involving the BA.4 or BA.5 subvariants. we will be closely watching the development of this new Omicron subvariant and where they are found and the proportion they make in the overall case count. There's a chance that these subvariants will start to take up a greater proportion of all the cases in the community. There's transmission. And based on information from the World Health Organization, these subvariants may be more transmissible than the BA.1 or BA.2 subvariant. That leads to a greater transmission risks. And there's a chance that, as we have seen from overseas experience, that these subvariants may become more dominant, but we will be monitoring the situation. But the scientific evidence does not suggest that these two subvariants will lead to more serious illnesses compared with other Omicron subvariants. In other countries where these subvariants are dominant, the hospitalization figures and death figures are comparable to the previous subvariants. Next question, the gentleman. I'm from Mingpao. You mentioned this inbound traveler from Dubai. Did this case get picked up after finishing quarantine? Where has this person been to? For death cases, the HA mentioned this patient from the care home who passed away. Which care home is this? Were there infections reported at this care home? Did this patient got infected in the past? This is a reinfection. Has genome sequencing been performed to identify the specific mutant strain involved? Among the death cases, how many were picked up only after the peak of the fifth wave? How many have gone through a genome sequencing to determine the kind of subvariant? And how many have to find out how many died with or died of COVID? And for the subvariants BA.4 and BA.5, they said that most of them, these carriers, were mild, had mild symptoms. How many are asymptomatic? Among the symptoms they display, what sorts of symptoms? Do we have a gender or age breakdown? Anything stand out? You announced a number of locations recently. Are there districts where that stand out in terms of where COVID is going? According to the CHP, when will BA.4 and BA.5 overtake BA.2 and become the dominant strain? Thank you for your questions. The arrival from Dubai. Based on the information I have, the case got picked up during quarantine. This person declared their address on the online platform. So we thought this was a local infection, but upon further investigation, we found out this is an important case. As for death cases, I will invite Dr. Lau to tell us more in a bit. Now, for the BA.4 and BA.5 subvariants, when we first got these cases, they involved people working in high-risk venues, including airport workers or workers at quarantine hotels. But recently, we're seeing local infections involving these subvariants. We don't see particular concentration in particular district. There are more than a dozen such cases across the territory. We don't see any epidemiological links between these cases with other cases. Overall, we see that most have mild symptoms. Some are asymptomatic carriers. For those with symptoms, the symptoms are mostly mild symptoms affecting the upper respiratory tract. and they're similar to those carriers of the BA.1 or BA.2, sore throat or coughs, mild symptoms. As the proportionate makeup among the asymptomatic carriers, I don't have the figure at hand. Maybe a further analysis will give us a figure and we will announce them later. As for the geographical concentration, we don't see the cases concentrated in any particular part of a city. As for genome sequencing, it has been done. For the BA.4, BA.5 cases found locally, most of them are BA.5 cases. There are maybe a handful of BA.4 cases, but for BA.5 cases, the whole genome sequencing results come from more than one source. That means people may have got infected at different locations with different viral strains. So they are not from a single source. We will keep monitoring the genome sequencing results from new cases. Some of those have genome sequencing results similar to those found from overseas cases. We believe these are triggered by overseas imported cases. As for whether they will become the dominant strain, that would take further observation before we can tell. It would take stringent measures for the time being by sending these cases to quarantine, to isolation, and the family members will be quarantined. From overseas experience, such as from those from the US, in the days to come, BA.4 for BA.5, due to their higher transmissibility, there's a chance that for these subvariants to lead to more cases. But as far as the science is concerned, vaccines still work in protecting against severe illnesses caused by these subvariants.
Most cases were adults. There were a handful of children as well, but I do not have the details. We might be able to provide that detail later. For the 88-year-old resident, I do not have the name of the residential care home she stayed in, but I believe some other residents from that home were also infected. On the 21st of June, she was transferred to the SWD's quarantine center. 2 days later, she started coughing and had fever, so she was sent to hospital. The hospital carried out a PCR test for her on the 25th, and she tested positive. The CT value was 23. Medications were prescribed, including an oral antiviral. As to whether any hospitalized patients were infected for the second time already, some patients told us that in March or April they tested positive at home via RAT. And when they were admitted, for some cases, the CT values were high or indeterminate. And in the subsequent days, the results were all negative. So according to our experts, for most of these cases, they were there could be residual virus. The cases were no longer contagious, and their hospitalization had little to do with COVID. They could be admitted for other reasons. For example, they might have tripped over or they had cardiac diseases. So we would now carry out admission screening for these patients, for instance, by carrying out PCR tests to detect such traces. Since the fifth wave started, 9,110 patients passed away in public hospitals, most of which were elderly people. We carried out a rough analysis on the causes of their death. We have looked at the death certificates of more than 8,000 patients who passed away in public hospitals. the numbers are still evolving, but from our preliminary figures, we saw that 60 to 70% of the deaths were related to COVID-19. The rest were either unrelated or they were referred to the coroner's court already. However, the situation remains fluid. Because as we analyze the deaths or new cases every day, these figures could change. I do not have that information. Next question, please. Last question. The lady in blue, please. I'm from cable TV. At Shan King Estate, Tuen Mun, we have continued to see cases. Does it mean transmission is taking place within the housing estate? For Shan King Estate, Tuen Mun, at least 2 buildings saw cases in multiple units, including King War House and King On House. I believe the source originated from Victoria Harbour Restaurant. There was transmission taking place within a family, and there was transmission within a building as well. So that was to be expected, and that is why we issued a compulsory testing notice for these buildings. We hope that through CTNs we could identify other cases from the buildings as well, and subsequently we found even more cases. We conducted investigation on these cases, and we isolated the patients and quarantined their close contacts, and we will continue to keep tabs on the situation. When we detect new cases involving Omicron variants such as BA.2.12.1 or BA.4.5, we would include the relevant places in the compulsory testing notices. The goal is to identify other cases in the same buildings to prevent further spread. At the housing estates, there could be common facilities or areas where different people would meet. So when we saw, so it's probable that there could be multiple cases in different buildings. This is the end of the press briefing. Thank you.